Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. So we have been continuing with the hepatitis B virus, hepatitis B. Now clinical manifestations. Now hepatitis B virus is so dangerous virus, and how the mechanism takes place, how it get internalized, and how it uses a hepatocyte cell machinery for its convenience to produce more and more virus. Okay, otherwise virus, if it is an RNA virus, once it gets exploded, finish. But here it is not like that. It will again duplicate, reproduce. That is only possible because it's a DNA virus. It contains a DNA polymerase, which can do so many multiple functions, just like an all-rounder, and that is the reason why it can produce. So now, therefore, it can produce an acute infection of hepatitis B virus, which is associated with a viral hepatitis. Now, when the virus enter inside the body, if the body immune system resists it, definitely there will be an acute infection, isn't it? So now, if the body immune system is not able to resist it, the infection may not be there, but virus is growing inside. So acute infection may be there with the hepatitis B virus in associated with the acute viral hepatitis. There will be general ill health. The virus is slowly developing inside. The virus is spreading to one by one. The virus is utilizing all the hepatocytes. Okay, initially it will do and multiply in one cell. Then ultimately that cell will going to die. Then the virus is already there, so that will go to another cell, that will do the same thing in another cell. So like that, it will completely destroy all the hepatocytes. It may take years together, okay, decades together. It depends now how active how the virulence is. If the immune system shows more resistance, then there will be more symptoms. If the immune system is suppressed, body immune system is suppressed and virus is gaining the importance, there may not be any symptoms. Okay, it all depends upon the body immunology and as well as viral virulence. So there may be general ill health, loss of appetite, nausea, vomiting, body ache, mild fever, dark urine, development of the jaundice, pain in the right hypochondria, just like hepatitis A, pain in the right hypochondria. Illness lasts for weeks and then gradually improves in most affected people. Initial illness will be there for a few days, then it will going to improve, but virus is not removed completely because virus is internalized in the hepatocytes. Sometimes a more severe form of the liver disease can develop, which is known as fulminant hepatic failure. This happens when the body immune system is very strong and it gives a strong response to this particular virus. Okay, then there will be a big battle between this body immune system and as well as or even when at time when the immune system is more exaggerated. Okay, there will be a more intensive reply to these viruses, and as a result, there is a big fight, and as a result, liver parenchyma get damaged, undergo inflammation, necrosis, and that leads to fulminant hepatic failure, leading to sudden death. Sometimes infection may be entirely asymptomatic. If the body immune system is not able to resist that particular virus at all, the course is totally asymptomatic and maybe get unrecognized at times also. But virus is there inside. One or the other day it will going to cause the problem, maybe milder. Now, either asymptomatic or may be associated with the chronic inflammation of the liver. These are the outcomes. Chronic infection. Whenever there is a chronic infection may be also at times asymptomatic, or it may be associated with the chronic inflammation of the liver, which runs in other courses like chronic active hepatitis, chronic hepatitis, etc. So chronic inflammation of the liver leads to cirrhosis over the periods of several years. It increases the incidence of hepatocellular carcinoma also, because some of the antigens which they are produced, they are also carcinogenic. So this is very common across the Europe. Hepatitis B and C cause approximately 50% of hepatocellular carcinomas. Okay, hepatocellular carcinoma in Europe, the most common cause is this hepatitis B virus. The chronic carriers should avoid consuming alcohol, as it increases their risk of cirrhosis and liver cancer. Hepatitis B virus has been linked to the development of the membranous glomerulonephritis also. The serum sickness-like syndromes occur in the setting of acute hepatitis B, often preceding to onset of the jaundice. The clinical features are fever, skin rash, polyarthritis. The symptoms are often subside shortly after the onset of the jaundice but can persist throughout the duration of the acute hepatitis B. About 30 to 50% of the people with acute necrotizing vasculitis, polyarteritis nodosa, are HBV carriers. HBV associated with the nephropathy is also described in adults, but it is more common in children. Membranous glomerulonephritis is one of the most common complications of hepatitis B. The other immune-mediated hematological complications like thyroglobulemiia and aplastic anemia have been also described as a part of the extrahepatic manifestations of the HBV infection. Okay, now one thing is that this virus uses the hepatocytes only. Okay, so they can only enter into the hepatocytes because they are hepatocyte specific viruses. Fortunately, they are not able to enter into the cells of the and make use of the internal machinery of the other cells. Only hepatocytes their favorite. So hepatitis B virus has been considered as a. Now talking about the antigens. There are many antigens which are produced from this virus. One is surface antigen, that is SBS-AG. This is considered as very reactive antigen. Body try to get rid of this antigen. So whenever there is an infection, this antigen is released into the blood, isn't it? And body immune system try to clear it. So when body immune system interact with the antigen-antibody reaction takes place, there will be a lot of symptoms. So yes, this antigen is hepatitis B, yes antigen. Yes stands for symptoms. So but all the symptoms which are produced in hepatitis, that is because of this antigen. This antigen is responsible because this antigen will always face a resistance from the body immune system. When greater quantity of the HBs antigen is released into the blood, there will be chance of more and more symptoms because this antigen always encounter a resistance from the body immune system. So therefore a lot of symptoms will be there. So when symptoms are that suggest that a lot of HBs and AG antigens are, that means HBs antigens are released. Talking about core antigen, that is HBC antigen. This antigen is produced in the core portion, okay, in the nucleoplasm, etc. So core portion, and that will not secrete into the blood circulation. Yes antigen will be secreted into the blood circulation. Whereas HBC, core antigen will not be produced, secreted into the blood. It remains inside the cell. It is doing all the activities there. Okay, it will not come into the blood at all. So only liver biopsy can detect this. Now, another antigen is E antigen. This is also produced from the core portion of the virus. This has got a minimum role of diagnosing the disease. In the diagnosing of the disease, we don't have any role of C or E. In the C, core antigen, okay, biopsy will go into give some result, idea. But the HBs antigen has got a very important role in the diagnosing. If HBs antigen is raised, definitely the antibodies which is related to HBs antigen, if it is raised in the blood, that is a clear-cut diagnosis of hepatitis B. So this anyway, hepatitis E has got minimum role in the diagnosing the disease as the body will not fight much with it. But this is the marker of severity. If HBe antigen is increased, that suggests that severity is more. Severity of the infectivity is more. When this antigen is raised, it indicates that virus is duplicating very fast inside. So more the antigen, more will be the infectivity and chance of infectivity to the others. Okay, so therefore if a hepatitis B positive patient, we have to see which particular antigen is raising. Antigen S is raising, E is raising, or C is raising. If E is raising, that suggests that this person has got more chance of spreading the infection to the others. Infectivity is more. Now, what are the proceedings? In hepatitis B, It's all about fight between HBsAg versus immunoglobulin. So as hepatitis infection occurs in the body, it releases the HBsAg as just repetition. As soon as the infection occurs, there will be production of IgM antibodies against the HBsAg, and all the acute stage of IgM is the first antibody produced. Now, how you will identify HBsAg is now increased? HBs is increased? Very simple. Because HBs always causes the acute infection, more symptoms. So whenever there is infection takes place in the body, always IgM. In the initial part of any infection, it is not G or A etc. increased. It's only IgM will going to increase. Okay, it's the initial marker of early infection. So IgM produced against the HBsAg in the initial period of acute infection. Meantime, IgM also produced against the core antigens also. Okay, core antigens also, although they are not very active in the blood, but in the hepatocyte they are active. They are causing infection. So IgM can be produced against the core antigen and also against the E antigen. So Ig takes about 6 months to come. Hepatitis B virus, Ig antibodies, they appear after 6 months to appear in the blood in case of HBV, and thereafter they will be there throughout the life, offering the protection against HBV. Now vaccination, we are actually planning that. Through the vaccination, we are giving that so that initially IgM rises, but after 6 months what happens? IgG start raising. This IgB will be throughout the life. They will protect you from hepatitis B virus. That's the importance of vaccination. Now, summary now, this virus enters the body during the incubation period, first 1 month, and it begins to duplicate in the body. As a result, the amount of HBsAg and HBeAg start raising in the body. Initially, patient will not have much symptoms, but as the viral replications increases, the symptoms like fever, myalgia, jaundice, right hypochondric pain gradually develops. Now the body worried and start developing some of the antibodies. Body want to develop IgG antibodies, but unfortunately they are not ready. Ig will be produced only after 6 months. So now body start producing the antibodies against the core antigens also, and now this ultimately in the initial part it can only produce the IgM antibodies. These IgM antibodies fight for their best against hepatitis C and hepatitis E and hepatitis C and prevent them from reproducing. Due to this, by this time HBsAg and HBe levels are start dropping. Okay. Meantime, after 5 to 6 months, body also start producing the IgG against the HBsAg and infection will be cured. Now there is another important thing which is called as window period that we will discuss in the next class.